Terrific. Wow, that was really outstanding, Indu. I'd have to admit, this is probably one of the best talks I've heard in this topic, and you're obviously paving the way in this arena. Many of us clinicians only think about pharmacologic options for Parkinson's, and then when patients talk about natural things that they can do or non-pharmacologic approaches to management of Parkinson's, I'd have to admit that many clinicians are not open to those or have much knowledge about these things. So I'm really happy that you're really exerting a lot of your efforts and your talent in this respect. Now, and I encourage people the audience to submit questions in the chat box, but I'm going to get started with a few. What were the challenges for you in managing your Parkinson's patients during this pandemic? Well, what things were more easy and what things were more difficult, and what things went wrong during the pandemic?
Yeah, so I mean, I think the challenges for all of us is seeing each other, in person and being able to touch each other, and in the sense of, many of us went into medicine to be able to, connect directly with our patients and hug them and, smile and see the smiles and be able to connect. So that was a huge challenge, let alone not being able to see my family and folks. And, that was missing that sort of, resonance and the in-person vibes, or having to wear masks even when we were in person has been stressful, and not touch our patients. So that first and foremost is something that has been a huge, problem as part of the pandemic. I think the virtual modalities have been exciting because we've been able to access some people that we may never have been able to access. Some of my patients drive 6 hours to come see me or fly in from other parts of the country. And I think being able to give some care virtually has been exciting, but not everyone has the ability to connect. I think we've missed a lot of our patients who can't do, digital solutions. They can't hear on the phone, they can't operate a device that's complex. And, I think these are not easy things to join Zoom meetings or, virtual visits. And so we're excluding people who may not be able to understand the technology. And so that's been a loss. And even at the VA, often we were only able to do phone calls in some patients. And as movement doctors, that means that we are only, it gives us a lack of being able to examine people in a certain way and write out things for them and to be able to help them comply. So that was an additional, layer of problems. On top of that, I think, many of patients on many of these virtual visits were saying that they were doing quite well, or that, they didn't really complain about a lot of things. And now that we're seeing people back, I think the effects of being mentally and physically disconnected from certain types of exercises and also people and the world and going out of their homes has been impactful in terms of even cognitive sorts of, when we measure things like MoCA scores, the Montreal Cognitive Assessment, or we're examining people from their motor standpoint. I think people have, been somewhat derailed in terms of they may have been on a trajectory, and I think that some things are worse. And I really hope and believe that we can re-rail our patients and help them get better, get reconnected, and that we can help bring people back from that sort of derailment in terms of cognitive changes, in terms of isolation and other things. So I think these are some of the practical problems that I've seen. And, we're really trying to now re-engage patients. Being able to see them again has been beneficial and help them understand how, they have some of this lack of engagement and proactive choices have affected them. So that's sort of been my sort of sense of things. Maybe I could also ask you, Dr. Evidente, what you've seen as well in terms of your challenges.
Yeah. Well, first of all, in the virtual world, it's kind of hard to really assess the physical deterioration of patients, especially so that your exam is obviously limited. And many of my patients also, especially the elderly ones, are really not Zoom savvy, and therefore, most of them have flip phones even, right? And so talking about Zoom and these virtual platforms is so foreign to them. So it's really hard for me to to gauge some of these patients of mine, and sometimes when I don't see them for a year or so, and just doing virtual assessments, and by the time I see them, a lot of them are really in bad shape, in terrible shape, and I don't really get the good feedback that I would from a good exam. And I think you brought up also an important point of seeing and touching and seeing your patient smile, and you interacting directly with them. There's something lost in the virtual world that just doesn't make up for that actual connection between you and the patient in a live setting. And believe it or not, whereas back in 2020, whereas there was an initial shock the first few months after the pandemic broke out, and almost all my patients wanted to go virtual. After about 3 to 4 months, even before the vaccines came out, believe it or not, many of my patients, when we call them for follow-ups, and we kind of say, okay, would you want to come in versus do a tele follow-up? Many of my patients, actually, believe it or not, would take the risk and just come over to my office and just want to connect directly with me. And so those were the more or less the challenges that I encountered during this pandemic. Now I also see patients where they're very heavy on naturopath interventions, and some of my, I would say, some of my very frustrating cases were those that I know that the Western medicines would help them, and yet they're so engrossed in natural means like exercising, yoga, supplements, and so on and so forth. And then what even pains me more is that they end up seeing naturopaths that do all sorts of interventions like chelation therapy and high dose supplements, and so on and so forth. So how do we strike a balance between Western medications and interventions and these natural interventions?
Yeah, that's a really good question. So I think that a few things. So, when we talk about integrated medicine, it's literally like integrating this with this. So the historical sort of term for that was complementary and alternative medicine, which I don't like the word alternative because it makes it seem like it's one or the other.
Right.
I'm a big believer in, levodopa and DBS and the right symptom sort of profiles. I believe that we need both. And I think we need to start opening our mind to the fact that as clinicians, we don't have all the answers to all the symptoms. So we have good motor treatments. I think in general, we are able to help motor disease to some degree, but this non-motor issues, we have very little that moves the needle, and that really often affects quality of life tremendously in our patients. We also have to understand where the patients are coming from. When we do surveys, 60% of Parkinson's patients are doing some kind of integrative modality. And they don't tell us because we shut it down when they come into our office. And so I'd rather know and be part of a dialogue and be open than have patients not come in and then, or not tell me about whole things that may actually, from a safety issue, be conflicting or, be problematic for me to not know about. So I really think it's important that our patients are hungry for this. I'm trying to meet them where they are. I've found that for me, it helped me with certain aspects of my own life. So I started attracting patients that were interested in yoga, which is why I ended up getting quite more and more interested. And I think we're starting to get data. So it's not that we don't have any scientific proof of some of these, especially lifestyle choices that I think are part and parcel of actually healthy aging in general. There's nothing terribly unique about some of what I told you that is different for an Alzheimer's patient versus even longevity, like talking to people about how to age well. I think many of us, if we think about even as clinicians in the pandemic, we had to stick to many of these things just to get through, some of the very stressful timeframes. Much of this is what we talk to each other about and what we are trying to do for ourselves. So it's nothing terribly unique, but I think, so I'm not talking about getting off of levodopa. I'm not talking about, I tend to give levodopa actually, and our colleague, the naturopath, is actually a big believer in levodopa in order to feel optimally well motor controlled so that you can participate more in socially connecting, participate in more in the lifestyle choices and exercise to the fullest. We don't want to do the body a disservice by depriving a chemical that's missing and then trying to go crazy with exercise yoga, because that's actually dangerous. The other thing that I'll say is that, largely a lot of the schools of medicine, so traditional Chinese medicine, Ayurveda, it's not taking turmeric, putting it in a powder form, and then putting it in a capsule and then sticking it in some body part. It's really about more of a holistic lifestyle approach. So the notion that you, are living in a way that is in sort of a balance with the environment that you live in, that you respect the plants, you eat seasonally, you're eating turmeric from in curries, you cook it with pepper, you cook it with ghee, which is like a, something that's a fat that helps you to absorb it. In fact, when we take any one of these things and we try to control them and randomize them in Western ways and try to extract just this component, often these fail. And that's because, it's really more of this whole lifestyle approach. And I think any one component may not be the solution. It's really this more holistic sort of thing. So I think we have to sort of picture it in the sort of setting of, you as the person living in your environment, what speaks to you, what brings you meaning. But I think we've really done a disservice to not educate around any of this historically. A lot of the times, traditionally, a patient would come in, they'd complain of a motor thing. We check a motor scale. We would then give them a pill, see them back in 6 months. There was very little tweaking of anything or sense that they should be doing anything in the meantime. And I think patients are really wanting to know what they can do to change the course. And so they were then finding each other and realizing that, oh, this exercise seems to help, or that this person looks better. And as Jim wrote here, in the chat, I'm a patient of yours, Dr. Evidente, has integrated 30 minutes of exercise 5 times a week, some body scan meditation, general meditation, as well as eating healthier. And when you do some of this stuff, you feel better. So, taking medications as prescribed along with the techniques I mentioned above have really helped. So, so it's really a combination. It's not one or the other. And I think it's partnering with the people who are providing your care, being open-minded as a neurologist, that as a Parkinson's neurologist, I'm not the only source of all this information, that I work as you have a whole team of people that put this thing together here, that it's not, just any one of us. We can, farm out some of the care. The patients can get some help from maybe somebody that they trust in their community that may not wear a white coat at all. It might be a physical therapist or somebody else that can be engaged to help them stay on the path, check in with them, and make them feel better as part of the therapeutic sort of relationship that is gained. And that I mean, a lot of care for Parkinson's patients in the world is not being done by a neurologist, let alone a movement disorder specialist. It's really, general practitioners that have very limited time to know about this stuff. And so we have to engage the resources that we have in the community. I just came from, the reason I came to Arizona was to work with the power folks, the PWR, the physical therapists that have really defined how to work with these patients. And they are so energetic and so knowledgeable, and they spend so much time learning about what matters to patients. They're teaching me stuff, so I think it can be a dialogue from the patients, from the people who are spending the time day to day with the patients, the caregivers. Everyone needs to work together to sort of own some of this so that we can really move the needle. Because I think the traditional approach of the paternalistic approach of a clinician just knowing all the answers and giving you the answer as a patient, and then the patient's just passive, obviously is not the right solution to my eye.
Yeah, and then is you highlighted the usefulness for yoga, but is this something that any Parkinson's patient can participate in?
Yeah, so I mean, I think that if you look at many of these practices in essence, so yoga is not, I mean, we unfortunately brand all of this stuff. We brand Parkinson's as a disease of those pictures of, we have to sort of get more educated, I think, about all of these things. So yoga was actually brought to the West by BKS Iyengar, and he was somebody who in his teens almost died because he could barely breathe. He could barely walk down the street. People had written him off, and they were like, we don't have anything to offer you. So he went into a yoga sort of practitioner, and he started working on breath work and was able to rehab himself there. And then he's taught yoga over a lifetime and really rehabbed himself as somebody who lived in a body that was really almost on death's door from TB or something. Then when he was in his 60s, I believe, he got in a big car accident and could barely walk. And then he used yoga with the modifications to again rehab himself. And then he finally
Wow.
passed away, I think, in his 90s. So he embodied really sort of a sense of, but yoga again is meditation, breath work, and the breath work is very teachable. And then there's the poses, and the poses are, yes, at their fanciest can be, fancy, one-handed cartwheels and, handstands, but really you can do yoga. As I showed you, one of my collaborators is in a wheelchair and teaches yoga to spinal cord injured patients. And some of the effects just are amazing of just, the right cues, and even somebody who has a high C-spine transection or ALS patient, really advanced disease, even into the palliative care, death and dying populations, they're able to offer some of the benefits. So I think, again, if you're thinking that this is not accessible to you, I would, try to connect with maybe a local provider, teach them about your disease. Many of them are interested, and that's why we're trying to teach yoga teachers how to work with our patients. And this is a very modifiable thing that can really, be sort of find some class, maybe a chair class, and see. But again, safety is important. We
Mhm.
don't want people to walk into an advanced class in a 24-hour fitness studio and just do like what everybody else is doing without giving feedback to the teachers. So, but I think a lot of the benefits of this tai chi, there is something for everyone that we can do. And if you're not getting something, then maybe you're not with the right, sort of teacher. I think you want somebody who's open-minded, who is understanding of where you are. But yes, yoga can absolutely be taught even in somebody who's barely can move anything, at all. As I showed you that video of the picture of Matthew Sanford, who is a highly inspirational, teacher to me, and is actually paralyzed from his chest down.
Wow. Yeah. You have any thoughts about boxing?
Yeah, I mean, so I think boxing is great. I mean, I think boxing, I mean, I'm not very, if most people who know me know that I'm very, very open-minded to a lot of things. And if you love something, then you're going to do it. So find what you love and tell yourself, write down what you love in all of those bubbles, when you think about it, like what do I love to do? Who do I love to spend my time with? What did I love to do? And if you can't, I give these talks to people and they're like, oh, I kind of forgot that I actually really like to do this, or I've always wanted to try to learn Italian, or I never got a chance to do this because I was too busy. Well, try it, right? So if you love boxing, there's some great rock steady boxing or different types of boxing folks all over, and many people are getting engaged in things that they never thought they could do. I think, I think there's a tremendous benefit to, again, that group experience and the mind body sort of, coordination, and they do some stretching, and they, so I think there's something for everyone there. And I have a lot of patients who love boxing. I have a lot of patients who, there's folks that have done karate for Parkinson's, rock climbing for Parkinson's. I mean, you name it. We've had blogs, and Mike and I have been, working around all kinds of folks and been very open-minded, singing groups for Parkinson's. So I think, again, find things you love and find a partner and maybe start a group. And if you don't have it in your community, maybe, think about it in an open-minded way. But I'm extremely open to, and I just came from that retreat. There was a Bollywood dance class at that retreat. There was all kinds of fun things. So, I think that it's really about connecting and getting into that sort of enjoyable place. And, if you can get your heart rate up as well, it's definitely a bonus. So.
Yeah, yeah. And then you mentioned about exercise and about having, your recommendations is 30 minutes per day, maybe 6 to 7 days per week. But how does one know whether the exercise is effective or not?
So that's a good question. I mean, I think that when you talk to people like Bas Blom, they will say that if you can do something where at a pace in which you, just to break it down, because I mean, a lot of these, sort of like research studies in which we're putting people on a treadmill and measuring their heart rate, and it's all very complicated, and you need to get to 80% of this max. I think a simple, quick and dirty thing from a cardio perspective is if you can do something and you're slightly out of breath, where you can still carry on a conversation, but it's a little hard for you to, quite talk comfortably, that's probably a good pace. And if you can do that for 30 minutes, 5 days a week, I think that's reasonable. I think a lot of the studies that are coming out, there was a Korean study that just came out that was like, I think 4 hours a week of relatively like moderate, light to moderate. So even some housekeeping, I was like, who wants to do housekeeping for 4 hours a week? I mean, that was like, not what I want my patients to be doing. I want them to be doing fun things, getting out in nature, like going for a hike or going for a walk, saying hi to their neighbors, so again, mix it up, whatever you're going to do that you like doing and that's sustainable. If you can find a friend and do it, that's sort of the best. So those are the sorts of things. I'm not very, sort of married to you have to do this or have to do that, because I think it's when people feel extremely like they have no choices and we give them something that there's no way in hell that they would ever be able to do. Like, I'm not going to go to the gym and sweat on a treadmill. Like, that's not ever, I'd rather be set on fire than do that. So why would I tell my patients to do that? You know what I mean? So I think we have to make things accessible. So, if some of you enjoy praying on Sunday with your church group, and then you can have a picnic, go for a walk, for 10, 20 minutes for some part of that, then you mix it up and you get a few benefits of all of these things. So I think, you have to make it something that people are going to want to do, or they're not going to do it.
Yeah. And I have some patients that push it to the extreme though. Like I have a patient that does maybe 60 or 70 miles of walking every week, which is a lot. And he's like 75 years old or something. So is there such a thing as overdoing exercising?
Yeah, I mean, so when we talk about that, I mean, I think in any area of medicine, there are those people who have had that, sort of overdoing X, Y, and Z.
Yeah.
And there
So
are,
almost like a compulsion.
yes. So I think in the impulse control world, there are people, I've had some patients who exercise sort of at where they overdo some things, like to a point where you're just like so restricted with their diet or so this or so that.
Right.
And so I think that there are, if you're hurting yourself, if you're harming yourself, if you need to take pain medicine because you're overdoing it, or your doctors or other doctors are saying you've trashed every joint in your body. And I have patients like that. They have one knee surgery after the other, and then a hip, and then a this, and then if you're constantly injuring yourself, then I think you have to sort of revisit a little bit, maybe check in with the physical therapist, think about, what are the benefits, what are the risks of the things that you're doing. I do think that sometimes people do get these endorphins, so they get these chemicals released
Yeah.
that help the non-motor issues. And those are definitely a good thing, but we have to honestly balance risk versus benefit with everything we try to do in aging bodies, bone health. If you're harming your, I think needing excessive surgeries or something else is happening, you're in horrible pain and you're pushing through it and taking pain medicine just to be able to get that, then maybe we're not, this is not the right prescription for you and we have to modify it. So I think many of these things should be accessible and safe as well. And I think, again, on the question about the supplements that you would ask me, the FDA doesn't regulate supplements. And so we have to be quite mindful of when patients think that they're getting, I'm taking curcumin or, turmeric or whatever in this pill, we don't really know what's in a lot of those supplements, or even probiotics. We don't know what's in some of these. So I think if you can get it from natural dietary sources, if you can think about, good ways to get some of these things that are, from the source, then that's the best. I don't personally send people to the supplement store to take every vitamin and supplement out there. I think there are certain things, labs that can be checked. B12, for example, deficiency is quite common. Vitamin D is another thing.
Sure.
Bone health, if your calcium's very low, things like that makes sense. Otherwise, a balanced diet with lots of fresh fruits and vegetables, lots of fiber, good hydration. Most things can actually be gotten from those sorts of things, including the gut microbiome. Will be quite happy if you can get
Absolutely.
that dietary sort of thing.
Yeah. One last question before we take a break. Do you have any tips for patients with poor appetite? I really struggle with my Parkinson's patients who are losing weight. They're trying their very best to eat, but they just can't get, enough for them to gain weight. So you have any tips for those kind of patients?
Yeah. So one of the things that happens with Parkinson's is that the sense of smell gets affected, and then that affects the sense of taste. So I think that, increasing and the good news in some ways about Parkinson's is that since blood pressure is usually on the low side, salt can be liberally added. And so we can make food a little tastier. A lot of our patients are usually not overweight with Parkinson's, so you're able to add fats, healthy things that even ice cream sometimes. I'm not a huge stickler. I know some patients are worried about dairy. I think if you enjoy dairy and you love ice cream and you're too nutritionally sort of low, then adding things like dairy, Ensure, if you and buy a bunch of different types of Ensure and try all of them. And if you like one, then enjoy that one, So I think liberally trying to expand your calories and the things that you love to eat. You don't have to be eating necessarily healthy if you've lost too much weight. And then adding more fresh herbs sometimes can make things a little bit tastier, and then also amping up the spices because that sense of smell is not there. Sometimes we
Right.
have to excessively, add some things. So you may need, and I know I have had wives of patients be like, he used to love my spaghetti sauce and now he doesn't eat it, and I'm so sad. Well, maybe we have to, for his portion, add more spice and more, stuff if the rest of the family doesn't want it. But those are some ideas.
Okay, there's one question for you here. You want to read it, Indu?
Yeah, it says, is that the one? I'm right-hand,
Hi,
I'm
Dr.
right-handed.
Subramanian.
Yeah. Hi, Dr. Subramanian. I'm a right-handed whose right arm has stiffened due to Parkinson's, yet I continue to play tennis using the said arm. Could I be doing it more damage than good? So we definitely don't want a ton of asymmetry and untreated symptoms. So I would definitely look at the patient if I was seeing them and see if they need levodopa treatment to improve that disability motor-wise. And then once that's better, then they'll be able to exercise to the fullest, and we won't be putting joints at risk. Sometimes we injure hips or shoulder joints because one limb is not moving as well as the other, and we tend to favor that and then we can lead to injury and then back issues and other problems. So definitely go see your doc and check that out because we do want you exercise, but we want to do it safely. And then on the question about the satiety and the appetite, sometimes if people are also having dyskinesia that's excessive, they can burn calories and have weight loss. And so, if people are having good input and losing weight despite that, then I would definitely look at the bigger picture, make sure that there's nothing else going on. Sometimes, a hormonal issue or cancer, things like that can also affect this. So we want to make sure that people are checking in with their doctors, getting their thyroid checked, other things, and also that dyskinesias are not a huge problem because those can make people lose weight from too much caloric burn, and we can adjust the medicine and hopefully help the dyskinesia. But thank you so much for the
Excellent.
opportunity. It was really lovely.
Yeah, same here, same here. Sorry we kept you too long.
No, it's okay. I was trying to do all of the above, but this was super fun.
Absolutely.
So I appreciate the
Outstanding.
opportunity.
Outstanding. And
Okay.
have a safe trip back to LA.
Thank you. Be well,
Thank you.
everyone. Bye.
Okay.